the hospital was composed of temporary huts with 20 cots on each side, 20 boys, and joined by a covered walkway. And there was a pharmacy, and at the other end there were the operating rooms, about 3. And of course they were going 24 hours a day, 24. And we get those boys in, and all you could do is, muddy, khaki, bloody, you make them comfortable. And on each boy was a card saying the type of wound, had he had penicillin, had he had surgery, and had he had morphine. There were 4 things that they were. And so the minute when they were triaged, then they knew what happened. So we'd get them in the ward and either prepare them for surgery or, of course, look after them once they came back. And, of course, we'd have maybe, it's hard to think of it now in these hospitals, 7 or 8 post-op on the sides. And they had to have penicillin every 3 hours. And penicillin had just been discovered, and in February that year, I believe Churchill had one of the first doses. So at first it was scarce, so the doctor had to first say who very, very bad wounded boys would get it. And then we got enough, and everybody had it every 3 hours. So that kept you busy, because you'd run out of needles, so you're too busy to do anything else. You'd wipe off the needle and give it to the next boy.